Many times people do not understand the difference between an optometrist and an ophthalmologist because we are the only two professions that really look the eyes in depth. An ophthalmologist is a medical doctor or doctor of osteopathic medicine, an MD or DO, that is going through 4 years of medical school. And then they do a 1-year internship, usually at a hospital where they're working under another doctor that's practicing, even though they have their MD degree. And then they take their surgical specialty residency to be board certified as an ophthalmologist. That is 3 years. Many times, and most ophthalmologists have a subspecialty. That could be in glaucoma, that can be in retina, that can be in cornea, that can be handling the eyelids, surgery of the eyelids of the eye, and that could be an additional 1 to 2 years. So your ophthalmologists are basically your surgical eye specialists. And a lot of what we do overlaps with what ophthalmologists do. We're more of your general eye care providers, just like you have your internal medicine and family practitioner, where we do most everything that ophthalmologists can do short of surgery. We're kind of like the gatekeepers of eye care. The connections between various systemic problems and their eye health greatly impact communities of color, specifically the Black community. One of the things that I do every day when we examine a person's eyes is look at the blood vessels and the blood flow and the conditions of the back of the eyes, and we connect that with their overall health. A lot of times people don't think about high blood pressure as affecting the eyes, but hypertension can cause narrowing the blood vessels in the back of the eyes, just like high cholesterol can, and pre-diabetes. So a lot of patients have been told that they were borderline, pre-diabetic, and it wasn't a point of emphasis. The cutting edge technology that we have allows us to look at the nerve impulses and how the nerve fibers are transmitting the electrical signals in the back of the eyes. This allows us to see early changes in the back of the eyes, well before it's an issue. And I tell my patients, look, it's important to get these baselines so that over the years, we can monitor these subtle changes and talk to your physician, your caregivers about how you're handling your overall health and prevent vision impairment 5-10 years down the road. And those are some exciting things that are becoming more of the standard of care in eye care. The importance of preventative measures, such as adhering to your medications, adhering to your diet, adhering to your overall lifestyle, is so critical. These are points of education that we need to share with our patients, and patients need to take just baby steps. My own personal health journey is that I'm living with type 2 diabetes, and I did not adhere to early changes when I was pre-diabetic. I kept kind of getting ready to, and I'm gonna get to it until you have that diagnosis. So I'm walking that journey with my own patients and tell them how I do not want them to have that same journey that I did. But those are preventative measures, the lifestyle and diet, adhering to your medication, making your doctor visits are so very critical, even when you're feeling perfectly healthy. Regular eye exams and monitoring is so very important because it allows us to put the patient in a position where we can detect these conditions early. It places you in a position to where things don't sneak up on you. You're less likely for sudden onset of vision loss. As an optometrist, I like to see my children every year because they're growing. There are many tools that we have to prevent children from becoming more and more nearsighted every year. The specialty is called myopia management. So before, we did not know how to keep kids from getting their prescriptions from getting stronger and stronger and stronger every year. And there's some serious risk in adulthood when you have a very strong nearsighted prescription. So now we have technologies to deal with that. Moving on through college and your early working years, there's so many more demands put upon us with computers and with online learning and with various online platforms that we have meetings all the time. And people are experiencing more eye stress, more dry eyes from that. So I prefer to see people every year because very subtle changes in the prescription Your eyeglass prescription or contact lens prescription can make a very big difference in terms of how comfortably you're seeing. Now let's move into the 40s when people start having more issues focusing up close, a normal aging change in which your eyes kind of lose their focus and you might notice more difficulty seeing small print. We like to know how you're using your eyes day to day. All those demands are different depending on how you use your eyes. And so we're able to prescribe special lenses for those different situations. We connect the dots between how well and how comfortably someone sees with their overall health. What most people don't think about is that dry eyes can often be one of the very first symptoms of autoimmune diseases. Autoimmune diseases like lupus, sarcoidosis, rheumatoid arthritis, and these are things that can have eye effects, cause eye pain, sensitivity to light, and dryness. Sometimes those eye signs can be your very first symptoms that we kind of send people and put them back in the direction of maybe getting some blood work from their primary care physician or rheumatologist. When we're connecting the dots between your overall health and eye health, a lot of patients say, well, what can I do? Our epidemic with diabetes has been following our whole nation's trend in obesity. So we also track the patient's BMI, the ratio between their overall weight and their height, because BMI is also a risk indicator for heart attack, stroke, which people don't think about, as well as diabetes. So we monitor that and we help the patient track that just like their primary care physician. A lot of times we can see blood vessel changes in the back of the eye in patients that are living with obesity. So we try to let them know of that connection, and whether they have diabetes or not, whether they have pre-diabetes or not, they can still be living with obesity. And we connect the dots and help them try to steer the ship, looking at how their overall life and their vision is going to be 5 to 10 years down the road.